everybody's concerned about the sudden heart attacks which are happening and of young people.
Most people do not know that how fit they feel has nothing to do with how fit they are. More than 50% of the patients with the heart disease, they have no symptoms. It's called silent ischemia, and that leads to silent heart attack. Everyone is waiting for the heart attack to make its grand announcement that I am hitting you.
There were some rules which were brought about that school canteens should not have fast food, high salt content in the food and things like that. But if you see college canteens, if you see hospital canteens, you really don't get good quality health food.
If you eat too much of the fatty food, very large food containing a lot of carbohydrates, you develop changes in your liver.
Everybody's concerned about the sudden heart attacks which are happening and of young people, young professionals who are seem physically fit, I'm not saying are, but who seem physically fit, who are just dropping in the gym or at workplace. What is it that is happening? Is it something extraordinary, or were we hurtling toward this anyway?
Most people do not know that how fit they feel has nothing to do with how fit they are. More than 50% of the patients with the heart disease, they have no symptoms. It's called silent ischemia, and that leads to silent heart attack. Every time a celebrity or somebody famous has a sudden heart attack, media goes berserk and everyone start debating why it happened. It is simple. If the same person had few cardiac tests, like a CT angio, 10 years earlier, that heart attack, so-called sudden heart attack, could have been anticipated or prevented. So there is nothing like a sudden cardiac arrest. There is nothing like a sudden cardiac arrest. If people bother to consult the doctors, get the right tests done, all these deaths can be stopped. It is needless. It's only because of the feeling that you see the doctor when you have pain or when you have a problem. That is the fundamental flaw in the modern healthcare. I can understand 30 years ago, we didn't have sophisticated gadgets to predict these events. Today we have some of the most advanced medical equipments which can predict anything, which can give you the accurate information without even using a needle. And this is the beauty of healthcare. But people do not want to see the doctors when they have no pain. Everyone is waiting for the heart attack to make its grand announcement that I am hitting you. Everyone is waiting for cancer to make its announcement. Then they run to the doctor. You have missed the bus. I'll give you an example in Bangalore. City like Bangalore has at least few thousand young men leading a perfectly normal life, very active. If they run a marathon, they will drop down dead because they have very severe coronary artery disease, they have no pain. There are few thousand young ladies with early stage breast cancer. They have no pain, they will never see the doctor. But by the time they develop pain, it's too late. Modern healthcare has given amazing tools. It is the failure of the people to seek the medical help. Doctors like us, we don't want to go to people, go for the preventive checkup. Right? Okay, our friends and relatives and everyone, we can tell them. Otherwise, they'll look at us as, okay, he's trying to solicit for his business.
Cardiovascular disease was seen as a middle-aged men problem. It's not. Even when I was watching, there are 2 women who came in out of 5. So, can you please explain this to me?
See, there are many diseases people are born with, heart disease, right? So they should be treated when they are children. There are many diseases which are prevalent even in 10-year-old, 20-year-old, other than the what they are born with. So these things have to be diagnosed and treated. And it is not true that the coronary artery disease, which leads to heart attack, happens to old people. As I said, today it is the average age of my patients in England was over 60. Here it is 45, 50. Most people who undergo bypass grafting are less than 50. Yeah, good number of them.
And women?
Definitely the incidence of women in developing a coronary artery disease is significantly less till they reach the age of 40, 45. The hormone of women prevent them from developing the heart disease. For the nature, women are more important than the men, as long as they are productive life. So the nature protects the women. After 45 years old,
it's at the perimenopause and menopause level. Okay.
Then the incidence gradually starts increasing.
Okay. So when should, back to the same question, when should a person, a man, the primary bread earner, when should he go for a health checkup? When should he take his wife for a health checkup? When should he take his children for a heart-related health checkup?
Before a kid joins the school, they should be seen by a pediatrician for ruling out any serious problem. Then, when you complete your school, before joining college, the child's blood pressure should be checked. At that time, they are about 16, 18-year-olds. You'll be surprised, significant number of children less than 20 have high blood pressure. Significant number. Okay? So their blood pressure should be checked, basic checkup should be done. But when you reach the age of, past the age of 25, 30, every year you should have a preventive checkup. I'm not saying all the fancy scans and everything should be done every year, but at least once this fancy test has to be done past the age of 25, 30. And then you should be undergoing routine tests like a blood test or an abdominal ultrasound. These things should be done every year.
Doc, you spoke about diet in the beginning of our conversation. There were some rules which were brought about that school canteens should not have fast food, high salt content in the food and things like that. But if you see college canteens, if you see hospital canteens, you really don't get good quality health food. Even in our office, if we tried to bring in salads, it was rotting by the middle of the day. Everybody goes for samosas. Yes. It starts off in the morning itself. If you go to any hotel lobby, you'll see even in a 5-star hotel, people will go for vadas and will go for chole bhature in the first thing in the morning. I can see the arteries clogging up at 8 a.m. at the breakfast room itself. But how can we cause a change behavioral patterns in our country which tend to affect our heart right from childhood itself?
See, from the childhood, of course, education. But past the age of 25, 30, when you undergo preventive checkup, you will find whatever you are eaten getting presented in your blood test or somewhere.
Yes.
Like if you eat too much of the fatty food, very large food containing a lot of carbohydrates, you develop changes in your liver. You develop early blockage in the arteries. So essentially the idea of doing the preventive checkup is to hold the mirror in front of you with the numbers. Yeah. When your body weight goes up, when you become obese, the blood pressure goes up. Yeah. Many things happen.
And then the mental issues that come with it, in the sense of facing facts and wanting to change your lifestyle. That's the biggest hurdle, doctor. So you tell me, how do I tell myself and then tell my family that we have a problem? Houston, we have a problem. How do we go about doing that?
You see, the first thing is we have to learn to do simple things. Like sitting is as bad as smoking, right? Because our profession is such today that a lot of the people are sitting all the time. Yeah. So I strongly, I can tell the patient, you all have to walk every day. When you say walk, that means they take it for granted. You get up in the morning, then you start walking, right? But walking is not necessary that it should be done in the morning. The best advice I give it to my patient, all of you must wear a smartwatch
Steps.
and count the number of steps.
What would you suggest for older people to do beyond the age of 60?
See, the yoga is the best gift given by India to the world. I strongly believe that everyone, young and old, must practice yoga. As a young medical student, I was very much into bodybuilding and showing off your muscles. But when I reached the age of 50, I realized that a lot of the aches and joint pains you come across as we grow older, it's all because of lack of proper exercise to the joints and ligaments. And yoga is something which addresses all these problems.